Welcome to Toronto Children's Services Train the Trainer module. This module will cover strategies that will assist you in supporting providers with understanding and implementing the new requirements. In order to complete this module, you must have already completed the IPAC Tips and Considerations learning module, which includes hand hygiene practices, environmental cleaning, toy washing practices, and toileting and diapering. This module will cover strategies to support providers while they follow IPAC practices. It will support the setup and delivery of home childcare programs. It will also highlight some new important requirements and provide you with strategies to support. As a home visitor in this difficult time, part of your role will be becoming an IPAC Champion. What is an IPAC Champion? An IPAC Champion is the leader who role models how to enforce the IPAC expectations. An IPAC Champion leads by example and motivates others to get on board with the new expectations. Your providers will be looking to you for guidance. You must demonstrate that you have knowledge of the expectations and that you will be there to support them through this. Let's start with reviewing the IPAC requirements for hand hygiene. To wash your hands properly with soap and water, follow these steps. Wet your hands and apply liquid soap or clean bar soap. Rub your hands vigorously together, scrubbing all skin surfaces. Pay special attention to the areas around your nails and between your fingers. Continue scrubbing for at least 20 seconds. Sing the happy birthday song twice. Rinse your hands and dry them well. Turn off taps with paper towel. Open the door of the bathroom with paper towel in your hand and then dispose of it in a wastebasket. You must wash your hands every time you enter a room, play outdoors, blow your nose or a child's nose, change a diaper, touch garbage, touch food, or touch your face or anyone else's. Here are some strategies to support hand hygiene among your providers. Ensure you have reviewed any revised procedures related to hand hygiene with the provider. Recommend increasing access to hand sanitizer within the environment. Alcohol-based hand sanitizers with a minimum of 70% alcohol that has been approved by Health Canada may be used by children and adults. Remember that it must be out of reach of the children. Additional hand hygiene posters can be displayed around the environment as a visual reminder to clean hands often. Connect with individual providers virtually and have them demonstrate their hand hygiene practices with you. Let's review the IPAC requirements for environmental cleaning. If a surface is visibly soiled, clean first and then disinfect. For cleaning, use detergent and warm water to clean visibly soiled surfaces. Rinse the surface with warm to tepid water to ensure detergent is removed. Let the surface dry. Disinfect the surface using a solution such as bleach and water, Oxiver, or another appropriate disinfecting solution. Here are some strategies to support environmental cleaning in the homes. Ensure all providers are trained on how to properly disinfect surfaces. When disinfecting, the contact time for bleach and water is 2 minutes. This means the solution must remain on the surface for 2 minutes before it is wiped away. Each cleaning product has a different contact time. Check the solution label to confirm the correct contact time is applied when disinfecting to ensure the killing of germs. A cleaning and disinfection schedule should be in place with a record of completion, including high-touch areas. Help the providers to establish a method to increase the frequency of cleaning and disinfecting objects, toys, and frequently touched surfaces. Remember, this must be done at least twice a day. During a virtual call with the provider, have them show you the cleaning supplies they are using and where they are being stored. Let's review the IPAC requirements for toy washing. Toy washing is conducted using either a dishwasher or 3-sink or bin method. Ensure all the steps are followed, including contact time, disinfectant solution, and recording when it happens. Here are some strategies to support toy washing. Ensure each provider has a bin for soiled toys and a method for removing these toys from the play area after use. Remind the provider that if at any point play materials are mouthed by any child, it must immediately be removed from the play space. Consider having multiple bins around the environment for soiled toys. Encourage older children to place play materials they have used straight into the bin for cleaning. Review the play materials that need to be removed from the environment. For example, plush toys, porous toys, or toys that retain water, and sensory play items such as sand, water, and slime are to be removed. During a virtual call, the provider can show you their setup and you can provide additional feedback and suggestions. Moving on to personal protective equipment. Personal protective equipment, or PPE, is equipment that will protect the user against health or safety risks at work, such as contaminated surfaces or infected droplets. Examples of PPE used during this time in early learning settings are gloves, face masks and coverings, face shields or goggles. Surgical masks should be used during screening or when a child displays symptoms of COVID-19. A cloth mask can be used at any other time. Here are some strategies to support the providers. Ensure that providers are checking the amount of PPE they have and is available in a convenient yet safe location. Have virtual calls to role model how to wear PPE appropriately. As a visual reminder, create a checklist or poster when the provider is to use PPE. It is important to check in with providers and ensure that they do not have a false sense of security when wearing PPE, such as masks or gloves. Remind providers that they must follow all hand hygiene, physical distancing, and toy washing procedures that are in place. Moving on to screening. It is essential to have a screening process in place. Providers will need to designate an area near the main entrance of their home to conduct screening, or the screening can be completed by the parent prior to arriving at the provider's home. The parent needs to call the provider with the screening results, which the provider will record. All individuals, including provider, children, and residents of the home, must be screened each day upon arrival using the criteria outlined by the Ministry of Health. Wherever possible, the parent should not go past the screening area. Here are some strategies to support providers with screening. Assist with signage and designating screening space. Consider how families will be informed about the individual provider's screening process. Practice or role-play the screening process with providers before their program reopens. It is important that providers feel comfortable with the screening process especially if someone is denied entry into the program. That concludes the training module. If you have any questions related to the content of this training module, please email qualityassurance@toronto.ca.